Hi everyone, I'm Brian Betts. I'm a member of the Indiana State Doctorate in Athletic Training Program. I'm a licensed and certified athletic trainer as well as a strength conditioning specialist. And today I'm going to kind of review a little bit about my my evaluation skills and what I do well or what I currently do and how I can improve. So in terms of history taking, um, I always ask the patient, what's going on in order to determine, generally why they're here. Where do they have pain to kind of specify more of a specific area, and I usually ask them to point to it as well to see if I can get really narrowed down. Do you have any numbness or tingling? This is to rule in or out neurologic symptoms. Have you ever injured the area before? To get an idea of any scar tissue or any other things that might be going on in there before I really delve into what's going on. And can you move it? This is just to see how their muscles are, if their muscles are working correctly, if they're intact, if their nerves are firing correctly, getting a better idea of all that. In terms of inspection, I always look for discoloration or deformity, any sort of bruising or anything like that, in order to determine where the healing process they are, where in the healing process they are. And I also, this kind of goes more into an objective area, but I always palpate the area of pain. This is in order to see if I can feel any deformities that might not be obvious upon inspection. See if I can feel any muscle tightness or anything out of a line that might be causing the patient pain. Then I usually go into range of motion, specifically for the ankle and the foot, which is what I'm focusing on today, is I usually check uh, passive range of motion in all four directions. I usually check in order to see, can if they don't actively move it, do I have pain to kind of just generally see what motions they have pain with. Then I go into active range of motion, um, and then comparing and contrasting the active versus the passive range of motion, I can usually rule in or out some muscle injuries, because muscle injuries, you'll probably see more of a pain with contraction of that muscle during active range of motion that you wouldn't necessarily see during passive range of motion. And I also would check toe range of motion, active, see if they can move it, and again, this to see, what muscle specifically. Is it an ankle mover, or is it a toe mover that is really injured? And then again, to get even more specific, I will usually do for the ankle manual muscle tests of dorsal and plantar flexion to gather, exactly how significant the injury is, get an idea of maybe if it's a strain, the grade of the strain, and then if they have pain with motion during active and passive range of motion. In the inversion eversion, I will usually check that as well. Manual muscle test the toes. If they're involved, I'll test them if I think that it might be you know, a muscle that goes into the toes. I will check that as well. Special tests. So the classic anterior drawer to rule in or out a talofibular ligament. The talar tilt, again looking at the integrity of the ligaments, specifically the deltoid and the calcaneofibular ligament. I usually use the squeeze test to eliminate or rule in or out syndesmosis sprain or fracture of the tibia fibula. Bump test to try and rule in or out a fracture, and then Kleiger's test again to rule in or out a syndesmosis sprain. I also will use metatarsal glide and as well as a carpal or tarsal glide in order to understand the integrity of the ligaments within the foot itself. So things that I think I can really improve on in terms of history and inspection. So in my history, I don't really ask if they have any change of footwear or the way they're training or their training surface, which can be a huge indicator of foot and ankle pathology, and therefore that would be a huge thing to kind of get to the root cause of why they're having pain. And then the other thing is I could also perform a gait analysis as the patient walks towards the treatment table. Usually I'm not very good at this, so again, that's going to be something I need to focus on in my clinical practice as well. I also, in terms of objective measures, things that I can improve on, I usually palpate the structure of pain, but I realize that I need to palpate the structures around it. So if the syndesmosis is sprained, or we'll say the anterior ATF is sprained, I'm going to want to palpate the muscles around that, the fibula, the tibia, the navicular, and the other, the deltoid and the calcaneofibular. It's kind of all the whole general area is going to be something that I'm going to want to palpate with a special focus on the area of pain. Excuse me. I also don't do a very good job of taking note of the temperature of the affected area. So when I'm palpating, I don't normally notice, like, is it warm or cool, to get an idea of circulation, inflammation, and see how the body's responding. And then I also don't do a very good job of, I don't usually check the circulation of the pulse, which is something I should definitely do, because I know I've had a patient recently who their pulse, with a condition where their pulse would be diminished, and that would be key in identifying the pathology. And then just some other things that I might do is ask the patient if they can run and jump, cut. Just ask them if they can. Maybe if they want to, they can continue to play. If they can't, well, then I realize that it's a little bit more serious and that they definitely won't be able to play. And the other thing is, I want to ask if they would like to try and continue to play, and then, because then this will affect how I treat them and what we do. If that's of course only if they are able to still participate. And the last thing is, I want to know the patient's goals. What does the patient want to get out of it? What's kind of their time frame in order to get them back up and running and doing what they need to improve their quality of life, which is ultimately what athletic training and healthcare is all about, to get our patients back to their ideal and optimal quality of life. Thank you all for watching. I'm looking forward to some feedback. Thank you.